New on Daybreak, IU Health is touting new state-of-the-art equipment used to fight cervical cancer.
So the second of two new pieces that has arrived recently just this month, also happens to be Cancer Awareness Month, Cervical Cancer Awareness Month, I should say. So here there are all these changes that are taking place just at the right time. Nina Criscolo kind of got a behind-the-scenes look at the machines, and also she's here to explain what it means for patients. Good morning.
Good morning. It means a lot more information for women with just one standard screening. The thing about cervical cancer is that doctors say it is preventable, and about 70% of cases are caused by high-risk strains of HPV, or human papillomavirus. The new machine at IU Health, nicknamed Bam Bam, was the first in the country. Now the only other place with one is Yale University. It allows IU Health to streamline the three-part cervical cancer screening process. Women can now get a typical annual pap smear and without any additional requests get screening from doctors, receive pap test results, know their current HPV status, and find out if they carry a high-risk HPV strain through genotyping.
We wanted to be cognizant of the time that patients spend at the physician's office. We want to make sure the physicians are seeing the patients that really need the follow-up, and the people that maybe are okay to go to a longer screening interval can do that safely.
That was Melissa Randolph. She's the cytopathology supervisor for IU Health. She says this streamlined screening process allows doctors to more closely monitor women with these high-risk strains of HPV who may have in the past fallen through the cracks. And at that point, doctors can take preventative measures and improve detection of pre and early cancer changes. The machine also helps staff at IU Health work much more efficiently. Bam Bam's partner machine, which arrived last year, is an automated pap processor which creates slides from the samples. That used to have to be done manually, which can take hours for each and every sample.
Okay, so let's keep talking about this here, Nina. Aside from getting our annual exams, what can women do to kind of protect themselves from cervical cancer?
Especially because it is the awareness month. Doctors are still saying vaccination is the best way to prevent it. But another thing to think about, smoking can really increase your chance for cervical cancer, which you wouldn't think about, especially if you have one of those high-risk strains of HPV. So just another reason to kick the habit.
More prevention possibilities there.
Yep.
Thank you, Nina.